I'm Deborah Newton, respiratory specialist nurse, work in the city. Started using the Clinitouch service as part of the Total Care COPD project back in 2012 for 2.5 years. We're now going to restart using the Clinitouch system for patients city and county-wide. With COPD patients, we find it quite difficult with patient compliance, particularly taking medication when they've got a chest infection. A lot of patients find it difficult to determine when they have actually got a chest infection, when to start the medication. There's a lot of travelling to patients' houses, which can make it quite difficult. We're trying to prevent people from going into hospital and looking at self-management so the patient actually can manage their condition, recognise when they're poorly and start relevant treatment. Clinitouch was a new system that we used, and it actually helped patients to manage their own condition. They did their observations, so their blood pressure, oxygen, answered quite a few questions about their condition, and this enabled us to actually see all those details on the system in the office, and if they alerted, then we could ring that patient and start their rescue antibiotics and steroids without delay, and this actually helped to prevent them from going into hospital. The patients really enjoyed the programme, and it was quite easy to actually set up in the patient's home. Sometimes the patients start their medication too quickly, so we do want the patients to monitor the symptoms, and if the symptoms are persistent over a couple of days, then that's when it's appropriate to start treatment. So it's good that the patient is using the Clinitouch system. We can monitor what's happening, speak to the patient and reassure that they've actually done the correct thing, starting the medication, or there might be other problems where then we can contact the doctor if it's something else other than a chest infection. It made a big difference to the patients as they actually started to understand their condition, and the monitoring system gave them confidence that somebody would actually ring them if there was a problem with their observations, and then we could actually start using the antibiotics and steroids if needed, and actually a lot of the time it prevented patients from going into hospital. This actually saved the staff from going out to the patients because they could actually see them on the conference button, so you could actually see the patients in their own home, and then this would save time travelling to the patients' homes and actually give us more time to spend with other patients. A couple of examples of how the Clinitouch programme worked really well. We had a patient who was actually, while they were on the programme, they went into hospital 3 times, whereas since they've actually been discharged off the programme, they've been in hospital 9 times, so that's made a massive difference when they're actually being monitored on the system. And also we actually have patients that feel as if they're being a burden and being a bit of a nuisance and contacting staff, whereas they were quite confident using the Clinitouch system, and then we could actually monitor how they're actually doing, and this did prevent quite a lot of admissions.